Hello, good morning everyone. I am Akhilesh representing Sarathi Development Foundation. Sarathi Development Foundation is a social impact driven organization working in Uttar Pradesh, and our major focus is on methodologies well linked with the impact, particularly on children, women and adolescent girls. And we focus on empowering the community on the one hand and engaging the government so that there is a sustainability of the impact we create through various projects. So we'll start with the presentation. Our vision is, as you are seeing, it's a pupil-centered and gender-sensitive, and this vision is very much well aligned with our programs, processes, results, and whatever we do at the grassroots level. Our key strategies, as I already said, that our major focus goes on facilitating the community to develop its own vision. Where do they stand today and where do they want to be after a certain period of time, and what are the problems they are facing. It is followed by the planning rooted in their realities, rooted in their needs and priorities. They develop their own actions, their own solutions, and also the support which they require from outside, particularly the government service providers. So this is the one approach. Social and behavior change communication is a major and integral part of our all the programs. This is not just a component, because when it comes to the behaviors, how the parents and the community is providing space to the adolescent girls particularly, and their attitude and thinking towards the women, and also how much they are coming forward to take the initiative, because it is their own responsibility to command the development process. Networking and mainstreaming, particularly with the government, because we know our own limitations. We are not delivering the services in physical way. Like we are working on health, education, livelihood, nutrition, but we don't have the doctors, teachers, because the government has its own structure and system, and there is no substitute to that structure and system. So right from the day one, we try to do the mainstreaming of our processes with the government. Evidence-based advocacy. And this advocacy in true sense is done by the community, by the target group only. And why I am saying this evidence-based? We facilitate the community to develop its own plan of action. On the one side, they identify the problems, needs, priorities related to the health, related to the education, nutrition, water and sanitation. So they come up with the data, and it becomes easier for them to raise their concerns, to put their concerns very clearly before the government. Because if sending the letter or complaining, that doesn't work. So evidence-based advocacy. Model development and replication, this has been the area of focus right from the day when we started to work. So we develop the models in the real grassroots situations, and then we try to scale it. And so far we have one model particularly focused on integrated micro-planning, social behavior change communication, red alert system, engaging the government. We evolved this model in Lalitpur district of Uttar Pradesh, Fatehpur district of Uttar Pradesh, and then we started to scale it up. And we have also developed a state roadmap, that is a strategic plan for sustainability and replicability of successful practices at the grassroots level. So that is becoming more and more focus area. So these are the thematic areas: women, child health and nutrition. This is one of the focus area. Children and adolescent girls empower education, safe drinking water and sanitation, livelihood and HIV/AIDS. One thing I would like to mention here, why we are comfortable to work in all the sectors. Because our focus is on the methodologies, processes and strategies. We facilitate the community, we generate the demand, we build the local institutions, we facilitate them to have their own plan of action, and we engage the government. So that's why we feel comfortable to work in all the sectors. Another reason behind working in all the sectors, because when we go to the community, see at the family level, see that these needs and these sectors look diverse, but when you go to the family, when you go to the person, so all these services in an integrated manner need to reach to the pupil, to the family. Unique model, the model which we have evolved, one is of course the participatory framework. The participatory framework, it's a very clear methodology evolved, which brings the community together, which brings different sections and subsections of community together. Because if you look at the community from outside, it will look like one unit. The moment you go inside, there are various sections and subsections based on social groups, caste, economic, even the political basis also. So this participatory framework brings them together to think collectively and design the action plans. Community management systems. We are starting the program, but who is ultimately going to sustain it? So right from the day one, the focus goes on developing a community-based structure and system. And what we mean by community-based structure and system, we develop the volunteers from different social groups existing in the village and the slum areas. We develop the groups like women group, adults and girls groups, community support groups, and linking them with the existing structure of the organization. Like in rural areas, it is the Panchayati Raj institution structure, and in slum areas, if we see, then municipal corporations are there. Because these are the structure and systems of the government are going to exist. They were existing before the program and going to exist after the program, so we link. But at the same time, this community level structure which we develop, that functions as a support group that supports, cooperates, raises the concern and do a lot of mainstreaming. Establish links between the community empowerment and behavioral changes. This is a major learning Sarathi got. When we started 15 years before, and while talking about the development, so general perception we found towards development was the infrastructure development, electricity, road, the buildings, right, such kind of things. But health of the children, empowerment of the girls, the depression adolescent girls are passing through when they are not going to the school and getting married at the early age. That was not being perceived as a development. So this process, is interconnected with all these things. And of course, I already mentioned about linkages with the public delivery service. Red alert system. This is something first time happening in the state of Uttar Pradesh. In coordination with the government in one district, Lalitpur, we developed in coordination with them the service delivery indicators related to the health, education, nutrition, water and sanitation. And the timeline was linked with each of the services they are delivering. And if that timeline is not met, then issue comes under the red alert. Like if hand pump is down for more than 4 days, it becomes red alert issue. It gets documented at the community level and it goes to the Gram Panchayat. If Gram Panchayat is not able to address it, this will be escalated to the block level. And if block is not able to address it, this will be escalated to the district level. So it's a well-documented system, not to make the complaint against the government, but raise their concerns, and more it is based on the cooperative model. This is what we have been able to do so far. 1692, around 700 villages we have already reached. 700 slums 6 months before we started with a focus on the processes I talked about. So 5,000 volunteers so far in place, and 900 women forums, 700 AGGs and 40 village education committees and children clubs and women and thrift groups. So this is the structure in place wherever we are working currently. About 278,000 families we have been able to cover and currently covering with a focus on health, education, nutrition, particularly social development indicators. 1.2 lakh adolescent girls we have been able to reach and we are working with them. Mainly dropout girls, because the major problem is more than 60% adolescent girls in age group of 11 to 19 years are out of the school. They are the dropout girls. And when they are out of the schools, their life is entirely different. Right? They are involved in the domestic work and they are visiting with their mothers as a domestic worker. They are fetching the water and really feeling very much depressed, for which there is no data available, particularly when they are witnessing the discrimination at their family level and at the community level, because less space is there, less mobility is there, and right from the childhood, the way they are groomed. When the boys are given, the gun and other kind of toys, and they are offered the dolls and all this. So our focus is on, and so dropout girls, we have a very clear strategy. We are setting up community resource centers. We have a structured curriculum of 4 to 6 months, which builds the skills on basic life skill, also entrepreneurial skill, and above all, linking them with the government service providers. Another reason behind, focusing on this target group is because if you look at the national flagship programs, our state-sponsored programs, and even the legislations, there is a very less space for the adolescent girls. Lot of programs focused on women empowerment, even the youth development. But when it comes, even the children, but when it comes to the adolescent girls, very, very rare programs are available. Now the government is realizing and coming into this. This is, Sarathi started in 1998 as a technical resource organization with a focus on children, providing training support, monitoring support to the NGOs, to the government and to the donor agencies. But very soon we realized that we cannot play our role effectively as a resource organization if we are away from the grassroots. So within 2 years after 98, we started to work at the grassroots level, and our role in two ways like grassroots organization and resource organization is well established over a period of 15 years. This is the focus on adolescent girls. Although we were working before 2003 also on the adolescent girls, but that used to be the part of the programs. And 2003 onward, we started to focus specifically on adolescent girls also while working on different other themes and target groups. In 2003, the Quality Girls Education Project in Barabanki district of Uttar Pradesh, we started with the 300 villages covering about 22,000 girls. In 2005, that was a turning point in the history of Sarathi. That was a large-scale program when we started to work on integrated micro-planning process rooted in the decentralized system of the government, which was not effective at all. So every village we facilitate to have its own plan of action, and it is well visible in the community. It is available with the service providers. And then 2011, further we added one small program in Fatehpur district focusing on basic life skill development of the adolescent girls on one hand and implementing the Right to Education Act so that girls and boys are getting enrolled and retained in the classes. 2012, based on our successes in from emerging from these models, we were selected by the Dasra Giving Circle to implement this model emerged from the rural areas in the urban context. In the Lucknow, which is the state capital, we are implementing this program with a very, very large picture in the mind so that we can influence the state government, district government, and take the successes, processes to other parts of the state. This is, it reflects on the girls in rural areas of Uttar Pradesh. This is the data, as already said, more than 50% if you see on the indicators, the girls are lagging behind. Some of the indicators are really alarming because adolescent girls are the future of our country, future of our society. If the situation continues to exist, we can imagine what is the society we are going to live in the coming years. So, an anemia is really a big issue. Education, look at the health front, education front, nutrition front, they are lagging behind. And the situation is worst when it comes to the socially and economically marginalized sections like scheduled tribes and scheduled castes. I'm talking about the caste. It doesn't look nice, but that is a reality. It is existing in the rural areas and in urban areas as well. Now, the girls are waiting for us. When they are out of school, we can see what do they do. How we are going to address this, of course, minimizing early girl marriages. And this one indicator addresses various problems related to the girls. It is linked with the education. When the girls are not in the schools, they are more vulnerable to the early marriages. And when they get married early, they are more vulnerable even to the death at the time of delivery because they are not prepared to become mother, physically, emotionally. They are not, biologically, they are not fit for that. Increasing sexual and reproductive health knowledge. Why it is important? Because there is no dialoguing at all. The girls are not sharing this with their parents. They are not getting the opportunity to share with others. So the project facilitates the processes of dialoguing within the adolescent girls group, influencing the behaviors of that. Then increasing education and life skill development. This is to improve their current conditions and position and also contribute in building their future. When we talk about the condition, that means their status on health, nutrition, education and all this. And position means when they come in the position to raise their concerns, to express their voice, start communicating, start taking lead on the issues affecting their life, involving, because adolescent girls cannot be empowered in isolation. Because the family, the community members, and whoever is around them, the government service providers, all have to come together. So we engage all the stakeholders, developing appropriate behavior so that parents start thinking, getting sensitized, what are the needs and priorities of the adolescent girls. Sarathi is best placed. What we are talking here, we have already worked on this. None of these practices is something which we are going to innovate, evolve and test. All these are tested methodologies over a period of time. Integrated micro-planning, I already talked about. This is done by the community only, and it brings the whole community, all target groups including children, adolescent girls and women together, and of course the government service providers. Community ownership of the programs. Community must own the program, and community owns when community is involved in the decision making, when the community is engaged, when community prevails on the issues and the solutions. Experience as grassroots and technical resource support organization, it helps us a lot. At the grassroots level, we are working in the 6 districts, and as a technical resource organization, we are working across the country, providing training support, monitoring, research, knowledge management. So when we are working at a macro level, the experiences help us to add value in our work at the grassroots level. And the learning from the grassroots feed into our role at a macro level so that we can do the justice with that our role as well. Red alert system, I already talked about. Just 2 things are added with this: timely and quality public service delivery system, and it has been well recognized by the government. Government asked us to train other districts officials also so that they can implement this, because it has emerged a very, the cost efficient and very timely system to improve the service deliveries. Engaging government, experience in large scale and similar programs. We have implemented large scale programs covering the whole district, the villages of whole district, covering the slums of whole district, and even the training programs, doing in more than 65 districts in Uttar Pradesh together for different persons. So that experience really counts, because it keeps us alert, and lessons are always with us, and that make us to do better. These are some of the processes. This is the tool which Sarathi developed 7 years before, how to track the behavior changes. So it is the women groups, adolescent groups, they are tracking how the behaviors are changing at the household level. This is the action plan. You can see this is the way integrated micro plan is developed: the issue, the problem, the solution, who is going to take the responsibility, who is going to monitor, and what is the progress on a monthly and quarterly basis it is reviewed. These are the community resource center, which is well equipped with the information and everything, where girls, you can see they are getting the information on that. These are the 3 major focus areas. Of course, the community driven processes, integrated village planning and convergence, capacity building. These are the 3 focus areas. This is what we are planning to cover: 500 villages in Fatehpur district of Uttar Pradesh, which is one of the most socioeconomically backward district. So this is going to be the outreach. 85,000 households, 35,000 girls, and this talk about the structure. 3,000 volunteers are going to be in place, 1,500 groups are going to be in place, and centers are going to be in place, and community support groups in all villages are going to be there to sustain the processes. This is the model. We have divided the whole area into 20 clusters. Each cluster has 25 villages. So in this way we are going to cover. At scale, if you see, 20 cluster coordinators are going to be there, and then counselors. These are the volunteers, and that is the community level coverage. 85,000 households and adults and girls. CSGs means community support groups and community resource centers. Yeah. This is the budget, 2.65 crore. These are, this is about the governance. It is evolved over a period of time and it is well established in 15 years. These are our supporters. And thank you very much. This is one of the community resource center we have established in Fatehpur. So thank you very much.